Welcome back, everyone. Weight loss medications are on the rise. There's a few to choose from, but how do you know which one is right for you?
Joining us now is Lauren from Utah Facial Plastics to share the differences between a few of them in this sponsored interview. And Lauren, this has become so popular. We're hearing so many people giving it a try and a lot of success stories, but it's a little overwhelming to figure out if you don't know. There's a few different kinds that UFP offers. What are they?
Right, so our main ones are Tirzepatide and Semaglutide. So they're often used to treat like type 2 diabetes because they have such good effect on insulin control and regulating blood sugar. They help to increase insulin secretion when that blood sugar gets high. So in doing so, you're getting better blood sugar levels. And then in the meantime, you're also getting kind of a delayed gastric emptying, so you're experiencing less hunger. So when you're eating, you're getting fuller a little faster and you're staying fuller for a longer amount of time. So it promotes that weight loss effect.
So with these different types of medications, how do you know which one is right for you, and what are some of the differences we have to keep in mind?
Yeah, so with both of them, I mean, it comes down to, we really pride ourselves on doing a really thorough intake with everyone because everyone's different. Someone might respond better to semaglutide, some might respond better to tirzepatide. They're both very similar. They're a part of the GLP-1 receptor agonist family. And basically, they're kind of a hormone that helps regulate the appetite centers in the brain. Tirzepatide is a dual agonist, so it also has the additional GIP receptor, and that's just basically giving it a little bit more of an enhancement. So sometimes people will see a little bit better of a drop in weight, maybe a little more quickly, but for the most part, both of them do really well. And everyone's a little bit different, so we go over your medical history, what have you tried in the past, what has worked for you, what hasn't worked for you, and kind of really take a deep dive into what their goals are to really figure out a treatment plan individualized for them, because one person might say tirzepatide was the only thing that worked, and the other person's going to say, well, semaglutide was my go-to. So it kind of comes down to just that overall assessment, really getting a thorough history.
Some trial and error. Mm-hmm. And now that people have been doing this for a little bit, are you seeing that it's safe? Are there side effects? What do they report?
Yeah, I think it's really important to make sure you're seeing a qualified provider. There's a lot of maybe too good to be true marketing now that we're seeing. If something is so affordable that it's too good to be true, maybe don't choose that. You want to vet your provider, but I think the biggest side effects are mostly related to the gastrointestinal system. So we might see a little bit of nausea, maybe some vomiting occasionally, but very, very rare. Most of it's just some nausea, maybe some constipation, maybe a little indigestion. Occasionally I'll get told that people are getting some burping. They're kind of burping, and it's just kind of like for a few days, and then it kind of goes away. But if they're on a good dose that works for them, they shouldn't be experiencing side effects that are kind of impacting their life. They should be very tolerable.
Well, Lauren, I like the reality, right? Because there are side effects. Just be prepared for them and find out what could be the tailored medication for you. And you also have some before and afters we were just looking at, and some really dramatic changes. You can see it in the face.
Yep.
I'm sure around the midsection as well.
Absolutely, yeah. The changes are amazing, and it's, whether someone needs to lose 15 pounds, whether someone needs to lose 80 pounds, like it's very individualized, and so.
It's such a drastic turnaround.
Yeah,
but I also hear that people are using it not only for weight loss, but for some other symptoms and medical conditions they have going on, and that they're just doing a little bit, just a little microdose. And what are they doing that for? What are the health benefits?
Yeah, so with microdosing, there's a lot of emerging evidence to show actually really good benefit for like cognitive health. So delaying that cognitive decline that we may get with aging. Also with like systemic inflammation, we see a big decrease in systemic inflammation with doing microdosing. Not even necessarily a dose that's to make you lose weight, but just enough to help with that inflammation in the body, help with that neurocognitive decline. It's pretty awesome.
Wow. Well, that's interesting. You also have a promotion for our viewers today, $100 off.
Yes, so $100 off your first month at Utah Facial Plastics, and we do follow people every month, but that first month you get your $100 off with promo code GoodThingsUtah.
What a savings. Make that consultation, utahfacialplastics.com. We love UFP. Lauren, so good to have you here.
Yeah, and then just one more thing we do also offer like bioidentical hormones and peptides. So that's something that's actually newer to Utah Facial Plastics, but we are going to be doing that. So I just wanted to kind of mention that today to let people know that as well.
Oh, we'll have to dive deep into that next time.
That might be another segment.
Yes, absolutely.